Local NHS bosses have now launched a formal consultation on their plans for the future of healthcare in South West London and Surrey. Their preferred option is to remove all acute services from Epsom Hospital and St Helier Hospital. This would mean the removal of A&E, maternity, children's, intensive care, cancer care, coronary care, emergency surgery and emergency medicine from our 2 nearest hospitals. They say that they would like to provide a single new acute facility to replace those services. This facility might be located at St Helier Hospital, it might be located at Epsom Hospital, or the preferred option is next to the Royal Marsden in Belmont. If this dangerous plan is carried out, it would mean fewer beds, care delivered by fewer consultant doctors, longer journeys for most people, a single A&E and maternity in place of 2, and a facility which is only accessible via emergency ambulance or with a referral from your GP. On the 6th of January 2020, a meeting was held in Bourne Hall in Ewell, where the NHS bosses took the decision to do this. The general public are clearly not convinced by their dangerous plans, despite their attempts to paint the downgrading of 2 of our existing major acute hospitals as if it were a good thing.
Can I stand up? Yeah. Thank you. Can I just hold it? I won't keep it too long. I am Bob Gill. I'm a general practitioner. I work in an area that has already gone through a similar restructuring and cutting process. In fact, Sarah Blow was in charge of the cutting and restructuring process there. You need to understand what you're up against. You're up against a system which will drive this through irrespective of the impact on your care. I applied to be the Clinical Commissioning Group Chair of my CCG. I was asked by the panel, and Sarah Blow was one of the people on the panel, whether I was willing to do things that were morally repugnant if asked to do so by the CCG board. That was one of the questions for me to ask at interview. I served the CCG as diabetes lead, and they wanted me to rubber stamp the cut and destruction of local diabetes services. I was asked in that role whether I could fabricate cases to justify the changes that were being made. The consultations that went through were heavily stage managed. They plant friendly people in the audience and they answer the questions that they want to answer. Difficult questions they postpone answering. So you will be subjected to a very cleverly stage managed consultation. The evidence is mounting that the destructive changes that these people are signing you up to across the country have cost 120,000 deaths. The life expectancy for people over 60 has declined by 6 months. The infant mortality has risen. Where I work, patients do not get access to a hospital bed because Sarah Blow and her companions rubber stamped the closure of our local services. On one day, I think that people are interested to hear me. Everybody interested to hear me? Put your hand up if you want me to continue. Put your hand up if you will forego asking your question and want me to continue.
Yes. To get around the audience.
Well, the public have spoken. This is the public Q&A and the public have spoken.
If you may continue,
the public has spoken.
Can we continue?
So you can take up to 1 o'clock, but there is another
I will stop as soon as 10 people raise their hand. I will stop as soon as you want me to stop. The public want me to stop, I will stop.
We're on 5, 6, 7, right.
Okay, I will have it. Well, hold on.
Can you keep it brief?
So the cuts and closures to our local services at one day within the last month resulted in 120 patients lying in corridors waiting for beds.
Exactly.
120 patients waiting for beds in Queen Elizabeth Hospital, Woolwich. Look it up, it was published. A study reported in December found that 5,500 patients have died waiting for a bed in hospital. 5,500 in the last 3 years. The question to the doctors on the panel: the mounting evidence of death and destruction is there for you to see. With what conscience and morality, how dare you sit there and rubber stamp these destructive changes? Thank you.
More of that.
Okay. I'm sorry, I missed your name at the start, sir. Dr. Bob. Okay. Bob, where was the figure of 120,000 from? That's all right, if you just tell me.
You answer the question. You're not going to answer the question.
That's all right, I was just asking where that was from, so the panel can answer.
Who say you are?
By Oxford and the London School of Hygiene and Tropical Medicine.
Okay, Oxford and the London School of Tropical Hygiene. Yes, who would take that on, please? Yes.
Let me start. I can't really comment on what's gone on in other areas. What we're here to talk about today is improving care for people who live in our area. So people who we as local GPs and local clinicians are responsible for, and that's what we're focused on. We're talking about proposals to keep both our local hospitals open. We're talking about proposals to invest £500 million in improving the quality of care for patients. This is something that we have been heavily involved with for the last 2 years as local GPs, with doctors from the hospital, with a whole range of other clinicians from the hospital and community. We have looked at the problems that Epsom and St Helier are facing currently in terms of workforce shortage in consultants, in critical services like specialists, like emergency care, where actually having senior clinician presence will save lives, it will improve the outcomes for our patients. The staff at Epsom and St Helier are working incredibly hard to continue to maintain safe and effective services, but they're operating out of crumbling buildings. Some of our patients
you're going to keep 85% of services in those buildings?
Get taken in an ambulance from one part of the hospital to another. We do not believe that is an acceptable level of care. The reason we are making the proposals to change and improve services across Epsom and St Helier is because we're fully committed to getting the best outcomes for our patients, and that's what these proposals are all about.
How much are you getting paid?
Does Sarah, do you want to answer any of the precise accusations that were made?
Well, yes, I wasn't involved in the decision around the Queen Mary's Hospital at all. In fact, that had already been decided before I joined.
What we did do
when I went to Bexley was build a fantastic new unit, which is now loved by the local people and has got lots of new services on site, including a cancer centre, including a renal centre and an owner treatment centre. So that firstly, so absolutely nobody's wrong in that, and you can check the minutes because I was not involved in that decision at all. Secondly, the other things he said are just untrue. So, I mean, but that's fine. Bob's obviously is remembering it in that way, but that, as far as I'm concerned, that is just untrue. And there were other people that were involved in that process.
Okay, thank you very much. Now,
The people behind this dangerous plan are putting consultation leaflets through your doors. It explains their 3 options, all of which would see acute services removed from one or both of our local major acute hospitals. The document does not contain an option to say that you disagree with all of their proposals. If you receive one and you decide to fill it out, then we suggest that you tell them, in no uncertain terms, none of the above. Tell them that we need to keep all services at all of our existing hospitals. We need more beds, not fewer. We need more doctors, not fewer. We need more hospitals, not fewer. We need more capacity, not less. And you might like to sign our petition at koshh.org/petition. This might be our last chance to save our local hospitals.